The city is expanding a program that works to keep people addicted to drugs out of jail and place them into treatment. The Narcotics Arrest Diversion program started in 2018 on the west side and has since directed more than 700 people toward drug treatment programs. Officials say it'll be in every police district by the end of the year. Joining us to discuss the expansion are Tim Devitt, Associate Vice President of Clinical Operations at Thresholds, who's been working with the Chicago Police Department on the program, and Deputy Chief Antoinette Ursity of the Training and Support Group with the Chicago Police Department, which includes the Crisis Intervention Unit that is facilitating the expansion of the program. Thanks to both of you for joining us. So, Deputy Chief, let's start with you, please. Can you walk us through the process of how a person gets into treatment?
Sure. So there's two ways where someone can access this program. One is, just as you described the program, it is an arrest diversion initiative. And so if an officer takes an individual into custody who's in possession of 1 gram or less of cocaine or heroin or syringes, needles, drug paraphernalia, if that individual is open to seeing a substance use treatment counselor and meet the eligibility requirements of the program, we're able right there at the station to connect them with a substance use treatment counselor with Thresholds. One other really important way that people are able to access the program is by walking into the police station where this all started in the 11th district and letting one of the officers there at the desk know that they would be interested in this program, and they can reach out to our partners and access the program that way too.
And what are some of the eligibility requirements that you mentioned?
Sure, that you would need to be an adult. You'd be arrested within the geographic boundaries of the districts where this is operational. So right now we're really pleased we're in 14 districts. That's why we think it's so important that it's expanding at this accelerated pace due to the longstanding partnership here, that we've really got the foundation here to start growing it now. That the person is interested in the treatment. So there's several factors that would make an individual eligible.
Right, and one of those factors being no prior violent arrests in their background, correct, or violent charges?
Sure, that would be actually one of, I guess I'd say, one of the disqualifying factors. So if there's an individual who's arrested and there's another felony charge at the time that they're brought into custody or another arrestable misdemeanor offense, we're not able to connect them to the program at the point of arrest, but certainly so much has gone into training our officers on this resource, making it known, having opportunities like this to let people know this program exists, that the more people know about it, that it is accessible.
And Tim Devitt, once someone is in the care of Thresholds, what kind of treatment or services do they receive?
So what happens at the police station is we meet with the person and we understand what's going on with them. We seek to understand. We look at their substance use. We'll talk with them about that. We'll talk with them about different treatment options, and then we work to link them to treatment in the community. There are people that will come to Thresholds for treatment, but we also work with other providers in the community as well. We're really basing it on what the person needs and where the best fit is for where they're at and their substance use issues and everything else that's going on as well.
Now, this program, we know that it started as a pilot in 2018. So looking at the city data starting the year after that, 2019, through today, there were over 8,000 narcotics arrests in the 11th district, but just over 700 people were diverted to use this program. Chief Ursity, why are not more of those arrests being diverted?
Sure. Like I mentioned, there are some factors concerning eligibility or entering into the program. So some of those those arrests that you're describing might have involved other charges. It might have involved an individual having convictions for serious crimes that would not make it possible to divert them at that point in the program. We also, because we've been working so closely with our partners, have been working to change our eligibility requirements. So for example, one of the important changes I think I'll share is that we've seen and understand really what the story of recovery can look like for individuals. So maybe for the data point where you're talking about, we see that one of the disqualifying factors is if you had used this program before and then were arrested again for that same offense, you would not be diverted at that point. But what we've really seen is that by expanding our eligibility giving more access to this program, that we see those kinds of changes are making it more accessible to individuals. So like a pilot program will do is you start somewhere and then you really try to enhance it. And so I think what we're talking about is trying to find the ways that we can enhance a program, such as changing an eligibility requirement like I just shared, and giving more access to individuals.
Right. And Tim Devitt, what's been the reaction from participants when they're getting into the program?
Yeah, there's a number of people that will start right out and share with us that this is something that it's time. That'll be a comment we hear often. This is time. I'm sick and tired of being sick and tired. It'll be what can be shared. We work to understand what's going on and connect people. So we're offering connection to care. We're offering connection to substance use treatment. And for a lot of people we're meeting, this also includes help with housing, if they don't have housing, if they don't have a place to live, access to health care. We're offering naloxone education and distribution. Naloxone is the overdose reversal medication for opioid overdose, and so that's also something we're offering people. We're offering education and treatment right there. And people are in the before they leave the police station. So there's an array of things that we're offering with people, keeping in mind that engagement is a big piece of this.
So looking at last year's opioid overdose deaths, 49% of total deaths in Cook County were Black people, many of them happening on the west side of the city where the program was first established. Tim, let's talk about that a little bit and that disparity. Why, Black people make up a third of the city's population, but Black men in particular are being disproportionately affected by opioid addiction and death. What do you think the cause of that is?
I think what's important for people that are doing this work and for organizations that are interested in being part of the solutions here is to get out into the community and actually see what's happening. And so much of the what we see anyway and what people share with us is that it's really challenging when an opioid addiction kind of develops for a person, and on top of that there's their need of a place to live, their need of meaningful activities like work or income generating activities that come from a job, and so much of this early work with people is about helping to establish some of this as well. So we see anyway with the folks that we're serving that this is a big need, and it's something that people are regularly asking us for help with. And so I can't emphasize that enough, that it's about addiction, but it's also about the social determinants of health, housing, employment, access to that, access to healthcare as well.
Which means your work, for the two of you is certainly cut out, unfortunately. Tim Devitt at Thresholds and CPD Chief, or Deputy Chief Antoinette Ursity, thank you so much for joining us.
Thank you.